I think it's 9:05, so we'll get started, and maybe others will eventually join in. So I would really like to welcome you all and thank you for supporting Childhood Cancer Hub. It's really very close to my heart because growing up, my dad was a pediatrician, and I grew up with all the time discussions about pediatric kids, babies, and if anyone would be detected with cancer, and I could see what he went through as a physician, and then when he would refer to the oncologist, the follow-ups and everything. So I was always touched, and though my area went ahead with breast cancer and pancreatic cancer, but somewhere down the line, it was always within me that if I could do something for childhood cancer. And that's when I got to meet Neil last year in May. And when he reached out, because everyone reaches out because of the word cancer, unfortunately. But that made me more stronger, the inclination towards the Childhood Cancer Hub. So that's how we came up with the Breast Cancer Hub being Childhood Cancer Hub. And we have a patient treatment bucket, and we are doing advocacy, and whatever way we can help, we are here for each and every child fighting cancer and their families, and we are here for you. Please reach out to us, and every possible ways we'll try to help. So and without further delay, actually, I'm so thankful and honored to have Dr. Munmila Hazarika, and thank you for your time today, Dr. Hazarika. It's really, I know how busy you are, and still you gave the time. And so our first speaker is Dr. Munmila Hazarika, and a brief introduction about Dr. Hazarika. She is the professor of pediatric oncology, Dr. Borooah Cancer Institute, which is a grant-in-aid institute of Department of Atomic Energy, Government of India. And she is one of the core persons for the WHO Southeast Asia Regional Practice Network for Childhood Cancer Services. Thank you so much, Dr. Hazarika. And yes, the platform is all yours, and we all are really waiting, looking forward to hearing from you about the global perspectives, the global burden, then your experiences and how you're overcoming the situation with childhood cancer, and of course the signs and symptoms. Because I know a lot of students keep asking me when I do their mentoring sessions for the cancer prevention and early detections. So, and they would love to know more from you. Over to you, Dr. Hazarika.
Thank you, Lopa, and thank you, Breast Cancer Hub, for having me here to speak a few facts about the childhood cancer, because September is the month of childhood cancer awareness. So I am lucky that you are having me here. So I have prepared a presentation. Okay, is it, it's okay now? You can see it?
Yes, we can see it. And okay. Before you start off, I would really request, all our participants and our other guests, so if you can mute yourself, that would be very helpful. Thank you so much. Over to you.
Okay, thank you, Lopa. So if you look at the global burden of childhood cancer, around 3 lakh children are diagnosed with cancer every year all over the world, with an overall incidence of 50 to 200 cases per million. And if you look at the geographical distribution of cancer children, then you will see that almost 80% of the cancer children live in the low and middle income countries, and around 20% of the cancer children live in the high income countries, the Western countries. So if you look at the cure rate of the childhood cancer, you will see that it is global cure rate is around 35%, but this cure rate is not uniform in over all the countries. So around in the high income countries, you will see that the cure rate is around 80%, and it is more than 90% in some cancers, like in acute lymphoblastic leukemia, that is a blood cancer, or like Hodgkin's lymphoma, you will see more than 95% of cure rate in the high income countries. But in the low and middle income countries, the cure rate is around 20 to 25%. So why there is this big disparity of cure rate? So if you see that in low and middle income countries, the resource is around 5% to treat these cancer children. But in high income countries, it is around 95%. So resource means your infrastructure, access to the treatment center, drug availability, and like your experts, doctors, nurses, all these facilities, diagnostic facilities, all these facilities, it is more in these developed or high income countries. So to remove this disparity, we have to utilize this minimal resource so that within next few years the cure rate in the developing countries becomes same as the developed countries. That is our aim now. So in India, we see around 40 to 60,000 new cases of pediatric cancer every year. And it's a very rare tumor. Actually, pediatric cancer is a very rare tumor, and that's why these policy making people, they used to give very little importance to this branch of like cancer. But nowadays, of course, it's getting a bit of importance in these low and middle income countries also. So this is one published data from National Cancer Registry Program of India. It was published just last month, August 2020. They have found that childhood tumors, it constitute around 0.7 to 3.7% of all tumors. In global perspective also, it is around 0.5 to 4.6% of all cancers. So it is a relatively new and small specialty. And the disease spectrum in India is not different from the West. If you compare the incidence with other Asian countries, so you will see that except this Delhi registry, this blue one is the Indian registry, blue one, blue columns are, and then these yellow ones are like other Asian countries like China, Republic of Korea, Thailand, Turkey and all. You will see that our incidence is less. And if you compare with like other non-Asian countries, European and North American countries, this blue is the Indian, and these are the other countries. Here also you will see that we see a less number of patients, but this may not be the actual fact, because it may be because of the under-reporting of cases. Here many patients, they do not reach the treatment center. They don't have access to the treatment center. As a result, there is under-reporting of cases actually. So if you see the age-wise distribution of the childhood cancer, we see most of the cases in 0 to 4 years of age group. Then the incidence decreases till 14 years, and then again there is increase in the cases in the adolescents and the young adults. And if you see the disease-wise distribution also, this purple like column is it denotes your leukemia or blood cancer. So blood cancer constitute 1/3 of the childhood malignancy. And this green one is your lymphoma. So if you consider both leukemia and lymphoma, that means the hematological malignancy, they constitute around 50% of the childhood cancer, followed by this yellow one is brain tumor. So followed by brain tumor, and then other tumors like bone tumor, we call it osteosarcoma or Ewing sarcoma. Then your cancer of the eye, we call it retinoblastoma. Then cancer of the liver, hepatoblastoma. Then cancer of the kidney, like Wilms tumor. Then cancer of other connective tissue called rhabdomyosarcoma. So all total there are 12 different types of childhood cancer, major childhood cancer. Of course, there are some uncommon childhood cancer also, but these are the main type of childhood cancer. So if you see the geographical variation, childhood cancers do not have much geographical variation all over the world as the adult cancer, because these cancers are not influenced by environmental factors like the adult cancers. So they are mainly your genetic. But even then, we see some geographical variation of the childhood cancers. So if you see that this is a leukemia, so leukemia that is a blood cancer, it is more common in Southeast Asian countries. But if you go to the sub-Saharan countries, the leukemia is not that common. But here this green, that is the lymphoma, is more common in the sub-Saharan countries. That may be because of the prevalence of Epstein-Barr virus in these areas, which causes your Burkitt's lymphoma. So in sub-Saharan countries, this Burkitt lymphoma is more common. So if we compare the childhood cancer with the adult cancer, you will see that the incidence of the childhood cancer is related to inherited susceptibility, that is the genetic factors. But in case of adult cancer, it is mainly due to your environmental factors. So adult cancers are mostly your lifestyle disease. So since there are very few environmental risk factors in case of childhood cancer, so there is less chance for primary prevention. You can prevent an adult cancer. So if someone stop smoking or stop taking alcohol, then the chance of getting many cancers, including lung cancers, in case of adult is decreased. But that is not possible. This prevention is not possible in case of childhood cancer. So since prevention is not possible in childhood cancer, so only chance to cure a childhood cancer is early diagnosis. But unfortunately, 80% of the childhood cancer are disseminated at the time of diagnosis, unlike the adult cancer, where we see only 20% in advanced stage at the time of diagnosis. So since early diagnosis is not usually, it is accidental, it's not very common, so there is no scope for screening also. In adult cancer, we can, as you know, that cervical cancer, oral cancer, prostatic cancer, all those we can screen the susceptible population and diagnose early. But in case of childhood cancer, it is not possible. This is one very important characteristic of childhood cancer, that is the childhood cancers are very much responsive to cytotoxic therapies, that is chemotherapy or radiotherapy. Because of that, although 80% of the cases are in a very advanced stage at the time of diagnosis, but the cure rate is very high. Even they are in advanced stage, the cure is possible. So there are very few risk factors which are established in the etiology or causation of childhood cancer. Two of them are ionizing radiation and ingestion of hormone diethylstilbestrol during pregnancy, which is no longer used. So there are some other etiological factors which are suspected, like genetic factor, then some viruses like Epstein-Barr virus, hepatitis virus, human herpes virus, and human immunodeficiency virus. And some children with immunodeficiency disorders seems to have more cancer. So why the pediatricians or physicians cannot diagnose a childhood cancer in early stage? Because it is a very rare disease, as already I have told you, very rare disease. So average solo pediatrician will encounter one cancer child per several days of practice in his chamber. So it is a very for him also, it is him or her also, it is very uncommon. And not only a long lag time between cases, but also the next case is likely to have a very different picture from the earlier one. So a high index of suspicion is necessary to diagnose a child with cancer. So this awareness is not only necessary amongst the community, but also amongst the doctors. Another problem in diagnosis is that in early that the signs and symptoms of the childhood cancer are very non-specific, and usually they mimic many childhood disorders like malaise, fever, enlarged your lymph node or glands, then your organomegaly, joint pain, anemia, headache, vomiting, fever. All these you see in many other common childhood disease, non-malignant disease, non-cancerous disease. So it is very difficult to differentiate. So this American Cancer Society, they have coined this very interesting mnemonic, children, to denote the early signs of childhood cancer. So here C means continued unexplained weight loss. This you can see any childhood malignancy. H for headache with vomiting in the morning. It may denote brain tumor. Increased swelling or persistent pain in bone and joints, sometimes accompanied by limping. This you may see in bone tumor. Also you can see in the leukemia, sometimes leukemia present with bone pain. Then there may be lump or mass in the abdomen, neck, or elsewhere, which may denote your lymphoma or neuroblastoma, or liver or kidney tumor. So there may be development of a whitish appearance in the pupil of the eye or sudden diminished vision. So this may indicate retinoblastoma. There may be recurrent fever, not caused by infection, that is important. So this you may see in any like childhood malignancy, more commonly in leukemia. Excessive bruising or bleeding may denote underlying blood cancer. The noticeable paleness or prolonged tiredness, this also you may see in any type of childhood cancer, most commonly in blood cancer. Now, when a child is diagnosed or suspected to have cancer, then he or she should be immediately referred to a dedicated pediatric oncology unit. It should not be treated in a peripheral hospital. That is very important. So for that, there need to establish a good network of shared care centers and pediatrician and physician. They should have a very close contact. So this is an ideal pediatric oncology unit. The inner circle constitute the persons who are responsible for giving treatment to the patient. That is the pediatric oncologist, radiation oncologist, surgeons, pediatrician, nurses, pharmacists, then your physiotherapist and dietitian, etc. They are supported by the the diagnostic facilities like radiology, microbiology, pathology, all those. Then what I want to share, that this the outer circle, outer part of the circle. This is very important, and this part is lacking in the low and middle income countries. So that is the social workers, research personnel, trial coordinator, data manager, and then your other community general physicians and local services, local organizations, various non-government organizations who work for the pediatric cancer patients. So this team, it is a teamwork, so it constitutes all these people. So after the child is confirmed to have cancer, then the treatment should be started as early as possible. So usually the treatment is a multidisciplinary treatment with chemotherapy, immunotherapy, radiotherapy, and surgery. And usually in case of childhood cancer, the treatment is very aggressive. The treatment is very aggressive and it is very prolonged, because childhood cancers are very aggressive tumor, unlike the adult tumors. So you don't see low-grade tumor in case of children. So treatment is very prolonged and very frequent, and dosing of like drugs are needed. So the family has to visit the treatment center very frequently. So there should be facility for their stay in the nearby. So that is another factor which is necessary for improvement of like your childhood cancer cure for the in the lower and middle income countries. Then since treatment is very aggressive, so they need adequate supportive care in the form of like your facility for blood and blood product transfusion, then you know, the support for diet, you know, the proper diet, then psychological support, and then of course facility for non-formal education, because the treatment is very prolonged. So after the treatment is finished, the real battle starts for the family. So since childhood cancer, you know, it is a very curable malignancy, so the children are going to live for a very long period. And since we give very aggressive treatment, and in the small children below 4 years of age, their organs are not mature enough, so these aggressive treatment, you know, they affect almost all the organs of the body. So these children are going to have you know, many side effects during their lifetime, so they need a very regular follow-up. So it has been seen that by the age of 50 years, the cumulative incidence of self-reported severe, you know, life-threatening disease or fatal health condition was 54%, almost 54% among the survivors, in comparison to their siblings, so which was around 20%. In their healthy sibling, it was around 20%. And you say that it is a self-reported. If you go for active follow-up, then the percentage will be, I think, more. So even if they do not have any like severe or fatal health condition till 35 years of age, there is a chance that they may develop a grade 3 or grade 5 health condition within the next 10 years. 26% people usually experience this fatal health condition compared with 6% of their healthy siblings. So these children, they need a very regular and you know, timely follow-up for a very long period. That is very important, and which is also lacking you know, in many centers. So survivors fight lifelong complications due to the aggressive treatment, which includes delayed or disrupted cognitive development, stunted growth, speech and or hearing loss, infertility and endocrine dysfunction, learning disability, then physical handicap due to amputation, then there are various you know, sign symptoms of organ damage, like there may be heart disease or kidney disease. So all these are seen. Then second malignancy, you treat a patient for a cancer, and because of the treatment, he or she may develop a second cancer in their later life. So to summarize, cancer is a leading cause of death for children and adolescents around the world. In high income countries, more than 80% of the children with cancer are cured, but in many low and middle income countries, only about 20% are cured. The low cure rate in low and middle income countries result from misdiagnosis or lack of diagnosis or delayed diagnosis. Or it may be because of difficulty in accessing the treatment center, or it may be because of treatment abandonment and drug toxicity or high relapse rate. Then childhood cancer is generally cannot be prevented or screened. Early and accurate diagnosis followed by effective treatment improve the cure rate in childhood malignancy. So thank you everyone for like listening so patiently, and if you have any query, I am like ready to answer your question as far as possible. Thank you, Lopa.
Yeah, thank you. Thank you so much, Dr. Hazarika. So we are going to have the question answer session after we listen to our other speakers from the survivor standpoint and also from the parent standpoint. And thank you for giving us an overview and getting into the real scenarios what you face and giving a comparative data between the developed and developing countries, because that is so important. I really wanted everyone to understand there are so many disparities and there are so many hiccups that as oncologists you face, and the socioeconomic condition, the infrastructure, it plays a huge role. And I think you have covered everything so nicely with the signs and symptoms, and definitely the after treatment is a concern, and it's a concern for all type of cancer. And when we think of the second cancer coming up with any, I think that's applicable for the adult cancers too. We see that, but also with all of us. 1 out of 3 people can get cancer. It is becoming so common these days. So, and we with different ailments as we grow older. So kind of like, we can tag that also with generally we are, maybe it's the environmental, but thank you for letting us know that with the childhood cancer, the environmental factors are not playing as much role, and even the diet and all of that are not playing as much role, because they are it's more like it just happens. And genetic also is like, but not as that the percentage is not that high. I think we really got a very good perspective from you, Dr. Hazarika. Thank you for doing this for all of us. And it was really, really amazing to hear you and your thoughts. And so now we will go to our next speaker, who is, I'm so proud of her, Krishna Mistry, who is an early childhood educator, and she is a childhood cancer survivor from Mumbai, India. And thank you, Krishna, for coming forward and sharing your journey. It's not easy for to do so, but you have. That is amazing. Over to you, Krishna. Thank you so much.
Thank you so much, Lopa. It's also my pleasure to be a part of awareness, of spreading awareness. So, hi everyone. Hope you all are doing well with the whole COVID thing going around the world, making everyone crazy. So, I'm Krishna Mistry, and I'm an early childhood educator. So, we've heard a lot of facts that Dr. Mundima has shared with us. I'm going to make the session very light right now. So, as I'm an early childhood educator, I'm going to narrate a story to all of you today. So, all I want you to do is take a back seat, rest, and just open your imagination windows. And I'm going to narrate this story so you can imagine, visualize how the story goes along. So, long time ago in the city of Nairobi lived a family of 5, and there are 3 siblings living in a home. The house is filled with laughter, giggling, playing here around, screaming here and there. And Krishna, true to her name, was the wise gang leader amongst the 3 siblings. So Krishna, Janki, and Shiv lived together, and they always enjoyed playing at home. Krishna was a school-going girl, so one day when Krishna arrived home from school, she came along with this one clingy friend. It wouldn't leave Krishna's side and bugged her to levels, causing her a lot of headaches. And it did not allow Krishna to do any of her schoolwork, which was also causing a lot of irritation to Krishna, because she loved going to school. She loved doing her school homework on time, and this clingy friend was not letting her do. It went on for 2 days, and then it caused alarm to her parents that something has to be done about this clingy friend. So one fine day when Krishna was at school, in the middle of the school hours, she was surprised to see her parents standing at the door of a classroom, and they had come to receive her because they were going to take her to the doctor. And Krishna was wondering that just because of a clingy friend who was giving her some headaches, why do we need to go to the doctor? But Krishna's parents were just like calming her down that it's okay, we just need to show it to the doctor. And they went to the doctor, and then the doctors over there said the solution for this clingy friend lies in Mumbai, where they are experts of doctors who can help her. So immediately within a day, her parents booked tickets to Mumbai. So Krishna her clingy friend, her mother and her brother, they all moved to Mumbai, where a family of 15 was waiting for them. When Krishna went to Mumbai, she was all happy because she also enjoyed coming to Mumbai and seeing the sceneries around her. So she was happy to see her family again. She was happy to reunite with her cousins and everyone. But one thing again, she was surprised to see all the adults of the family were equally concerned about this clingy friend, and she was wondering why would somebody be so concerned when a clingy friend is just giving her a headache. Then, when they came to Mumbai, Krishna, along with her aunt, mother, and her uncle, they started visiting different hospitals and started meeting different doctors. Krishna was not worried about why they are going to the doctor. She was enjoying seeing around the city. She had never seen the interiors of Mumbai, so she was enjoying the taxi ride, seeing the beaches, the roadside shoppers, and everything. And then finally, she reached this one big hospital. Krishna was more attracted towards the beach that was there next to the hospital, and she wanted to go there. But then her mother pulled her to the hospital. While her mother, her aunt, and her uncle were inside with the doctor, she was sitting outside with another aunt of hers, and she was exploring the magazines. And only thing she was concerned about, that will she get to see the Bollywood stars, because Krishna enjoyed watching Bollywood movies. She was asking her aunt whether I'll get to meet some Bollywood actors, or whether we can go and meet them at their places. And then after some time, the doctor calls in Krishna, and again she was confused, as in why is everyone so concerned about a small headache and a clingy friend. Then the doctor looked at Krishna. The doctor examined Krishna, and then the doctor asked the family to get Krishna admitted right away. So the next day, Krishna was admitted, but she was more curious to see the view outside the window. She was enjoying looking at the beaches and the never-ending roads that were going on, the highways and everything. But then she was really irritated when the nurses would come in. They would check her temperature. They would put her different pricks all over her body, which would give her a lot of pain. And then the next day was the day of her surgery. So then Krishna was a bit confused. Why is this surgery happening? So then her mother kind of explained to her that to get rid of this clingy friend, we need to do a small surgery. And if we do it fast, we can go back to Nairobi fast. So then Krishna was okay, fine, let's do it. And the next morning, the nurse came in with some weird clothes, and Krishna, as usual, was screaming, "What are these clothes? How do I wear them?" So her mother was very calm, very supportive, and she would just help Krishna with everything. And just within 5 minutes came in the peon with a wheelchair, and just asked one question: "Krishna kaun hai? Is pe baith jao," is what the peon said. So Krishna was very excited to sit on a wheelchair, and she was enjoying being moved on a wheelchair to the surgery room, and she was just thinking to herself, it's so much fun when you don't have to work and just sit and enjoy going to different rooms. Then, as they arrived the surgery room, Krishna got a little scared because her mother was not coming with her, and she asked the nurses that, "Is my mom coming with her?" Then the nurses just calmed her, "Don't worry, your mother's outside," and then gave her a small prick which put Krishna to sleep. Then, after the surgery was done, when Krishna woke up, she was a little scared because she was tied up to the bed. So all she did was just screamed for her mother. Her mother immediately came and calmed her down and told her that, "Don't worry, your surgery is done. You're fine now. They have just tied you up because you're not supposed to move." After that, I think she spent 1 week in the ICU. After that, they moved her back to her normal room. And Krishna enjoyed being over there because her bed was next to the window, and there was a nice, beautiful beach view. And her mother would play with her different games. So 21 days passed by in the hospital, and then the doctor said that you can go home now. But Krishna was still not aware that she still had to go a long way because she had been diagnosed with a cancer tumor. So then her mother explained to her that now it is time for treatment. You have to take a lot of treatment. So it will take a year. So we cannot go back to Nairobi before the treatment is over. Krishna was a bit upset because she was missing her father and sister who were back in Nairobi, and she was also missing her school and her friends. The next day morning, Krishna was surprised and happy to see her father and sister at home. They had come to meet her, and then again the next day, the hospital visit started. Krishna was going to the hospital. When they came to the oncology room, Krishna was just like, why is everyone so quiet? Why is this room so boring? And why is there nothing, like, why is everyone so sad? She didn't know that it's oncology room. There are cancer patients around her, and it's not something fun. Krishna was not aware that she had cancer because her mom did not tell her that, she was passing through cancer. After that, the journey started where we would go to the hospital. She would be pricked with needles. But the best part of this was traveling from home to hospital, looking at the outside view, seeing watching different cartoons while she was in the chemo room, and also she played a lot of games with her mother. So this is how the whole year passed by, and Krishna was then really concerned about what about school. So then her mother said that right now it is the month of May, and in Mumbai the schools are closed because of vacations. So once the schools begin in June, we'll take the admission. This surprised the doctors because they didn't expect Krishna to go to the school while she was taking chemo. But then Krishna was always like, wanted curious, and she liked going to school. So then in June we began going to school, and then hospital and school visits became part of Krishna and her mother's life. So this is how 1 year passed by, and finally the day came when the doctors told to Krishna that you're fine, you can now go back to Nairobi. And Krishna was the happiest because she was waiting for this day to come. When can she go back to Nairobi? So in 2003, that is 1 year after the treatment, they went back to Nairobi. Krishna, because she had missed a lot of schools during that 1 year, had to repeat the same standard again. But this did not upset Krishna. She was even more excited because she always wanted to be a twin with her sister, who was just 1 year younger to her. So she was more excited of being in the same class with her sister and, enjoying. And even more, she was happy because whenever she needed help with maths, her sister was there to help her in the class. Then, after a year in 2004, Krishna, along with her mother and siblings, moved to Mumbai for their education. So, here was the time when Krishna's actual test started coming in. Because when they went to one of the schools in Mumbai, she was denied admission because of her health history. The principal was not ready to give her admission. And then her mother called in all her children. So Krishna, Janki, and Shiv went to the principal's room, and then the mother just asked the principal one question: "Can you identify who's Krishna amongst these three children?" And the principal was shocked because he could not identify who was Krishna and who had undergone the surgery and everything. But later, Krishna got admission in the school. She was excited about being in schools in Mumbai, and her journey education started. But she had to face a lot of humiliations by the teachers because she was there with her sister, who was a topper, who was always a 98% scorer, and Krishna was always an average student. So she always faced a lot of biasness within, comparing of two sisters. But that never bothered Krishna because she was enjoying the classes with her sister, and her sister would always help her wherever she was stuck. So this is how 4 years of her schooling went by, and now it was time to go to college. So Krishna was even more excited because now going to college in Mumbai means traveling by local trains, and Krishna was more attracted towards arts and wanted to go to JJ School of Arts and pursue her architecture. But her parents and uncle knew that Krishna had to do big things in life, and doing arts may not help her to achieve those big things that were planned for her. So one fine day, Krishna's uncle comes in with the brochures of a college called SVT College of Home Science, and just asks her to browse through the courses that are given in the brochure. And then Krishna finally decides to do her bachelor's in nutrition and dietetics. And then again, the spark came in her that if she would do nutrition and dietetics, she would work in a hospital, and then she would help a lot of other children who had passed through something that she had gone through. So 2 years in college, she worked really hard to get into nutrition and dietetics. But again, there was no good news, because on the day of her examination, she was struck by meningitis fever, which took her straight to ICU. She was in coma for a week, and she missed her exam. She missed everything at that moment. But after she recovered from meningitis fever, her mother was always by her side, who kept motivating and encouraging her to give her re-examinations again. But when she gave her examination, she could not get the score that was required to go into nutrition and dietetics, which led her to early childhood care and education. So Krishna was a little depressed, because again her dreams were shattered, broken. She did not get what she wanted. So then came in her mentor, who said that if you want to work for children, the field of ECC is best for you. And that was the day when Krishna determined and worked passionately towards her field, and she worked hard, and she did her master's in early childhood education. And now it was time to move on to the next stage of life, from education to her marriage. So her parents made her biodata, uploaded on different marital websites, and also passed her biodata to different relatives. But Krishna never expected what had happened after that. She started meeting different prospects, and every time after meeting the prospect, after 2 days, she would receive a call with a no. The reason being the cancer history. So that again had demotivated Krishna again. But then she had to pick herself up, and she then worked harder. She did her PG diploma in counseling psychology and moved on and started working in the field of early childhood education. So it's 18 years now, and Krishna has planned that it's okay if you're not married. It's okay. Marriage is not the end of the world. There are many things that you can do. And to achieve her dreams, she's now planning to go to Canada. And this year is the year that she's completed 18 years of her cancer journey. And she'll ensure that she's buying only one ticket to Canada, and she's leaving back her clingy friend back to India. So, and the moral of the story is that no matter what age you are, you don't have to always wait for them. You can say goodbye to your clingy friend at any point of time. It took me 18 years to say bye to the clingy friends. So here am I, Krishna Mistry, in front of you, and this is the story of my cancer.
Amazing, Krishna. I mean, I have no words. I mean, I'm having goosebumps actually. So I don't know what to say. I mean, the way you fought through, and what you said, right? I mean, leaving your clingy friend behind is always this positive spirit. That's what I believe in. And the family support. I mean, thank you. Krishna's mom is here. We should clap for you also, your family also, the way you stood together. That is the most imperative thing, that we really need to understand, because family support. And as I tell you, Krishna, marks don't matter in life. It's like how you turn as a human being. That is the most important thing. And I tell to all my students also, we do not have to run after the marks because what we become at the end of our life is we need to become a good human being. That's more important, and how we can make an impact. And you are making an impact, and you are an inspiration for all of us. Thank you, Krishna. And it was really amazing how Dr. Hazarika pulled off with all the statistics and everything. Thank you, Dr. Hazarika. And Krishna, with your emotional journey, you kind of showed the world that, if we are determined, we can definitely beat cancer, and it will not come back.
That determination and motivation was just because of my parents. They did not let me view cancer as something that was bad or something that was, that I could not overcome. I got to know that I was a cancer survivor 3 years after I was recovered. So, it's how parents are during that state. And my parents are the most supportive, and obviously my whole family, even if I'm not married at this age, it doesn't matter. They are yet pushing me in another way. So it's because of my parents I'm standing strong here today. It's all
and
just
marriage is
because of them.
marriage is not everything in life, Krishna. That's totally fine. I mean, trust me. I mean, I can talk to you about this, and I have so many students who are not married, and they are doing, like, they did their postdoctoral fellow, and they are, like, different places in the world, and they don't care. Marriage is not like, the society made all these norms. You don't have to, and you can lead pride and dignity and your own self-respect. That's more important. So, and that's what you should believe in yourself. Thank you so much, Krishna, and God bless you. Yeah, God bless you. Hugs to you. And I think really, like, we get so moved. So our next speaker is another, like, Neelakant Yerra, who is professionally, he's a senior solutions consultant, but I got to meet Neil last year, May, and Neil is going to speak as a parent, from the parent perspective. And I must tell you that knowing Neil and his family, I'm amazed each day, and I cannot be more thankful to be introduced to you and your son and your wife and your family, Neil. Thank you so much, and thank you for honoring us being one of the speakers. Over to you, Neil.
Thank you, Lopa. Thank you for the kind word. And thank you, Krishna, for the story, because when we were going through all this, we always know what happens in our mind, but we don't know what is happening in my kid's mind. And sorry, thank you, Hazarika, for all the statistics. So one thing which we always think is, how can we prevent this? So one of the lines that give me 1 minute. I'm sorry.
Yeah, it's okay. Neil, just take your time. Yeah.
Yeah, sorry guys. So yeah, one thing we always talked, or we always discussed, is like, what would we have done in the last couple of years, or before and after, or anything, how we would have, or what we would have done different so that my kid may not get this. So one of the things that I was actually looking or waiting for that in your presentation is, like, is there any way that we would have done before my kid is born, so that he will not get cancer or something like that. But like you said, it's genetical, so it's not anything about the environment that he's in or anything on that. So thank you. That was one thing which I was looking for. So Krishna covered most of the things, so like what it be look like when it is from a kid's perspective, or who was undergoing the whole treatment and everything, right? So I will actually move fast in that area, because I have I'll talk more on how we survived this, how we have gone through all this 15 months of journey, and how we are still running through the same set of things that we do daily, so that we will do our daily chores, we will do our work, as long as we'll take care of the kids. So a little background. So me and my wife, we both are in USA. So we went back to India last year, 2019, April. for a marriage, and then we left our kid, my elder kid there, and then we came back. And so he's supposed to come back in June because we were expecting our second kid in June. So when he's out there and he's playing, and all of a sudden we got a call that he's not able to walk properly. And then he was taken to a hospital. Initially they thought it's a normal, he may be fallen or he has some issue in the leg and all the stuff. But finally it came out to be that there is a solid tumor on the right side behind his lung, which is actually pressing the nerves, and that's why it is paralyzing the lower body. So he was taken to an emergency surgery, and then they were able to take off some of the tumor pieces which are suppressing his blood vessels. And then he was in the hospital, and then he's going through all this. But where me and my wife, we are in US, and we were like, all we can do is just talk to him via Skype or via phone. So that was one of the toughest times. But that 7 or 10 days gave us time to at least prepare what to do next. So when my kid is finally discharged from the hospital from India, I took him directly to US, and then his treatment started from the day one he was here. And a big thanks to Lopa, because she was able to get me an appointment with the doctor the very next day when my kid landed in US. So there are like 5 or 6 things which we used or which we followed thoroughly in the last 15 months, so that we will be able to cope up with everything which is happening around us, along with the new thing or new daily routine that we have to work with. One of the things is support system. So if we were in India, maybe we may have a lot of people who can help us, but since we are in US, and then we can't have everybody, or we can't have all the relatives in the house so that we can help us. So we have to plan a very good support system, so that each one will be engaged and not will be overloaded, so that we can take care of everybody in the house. And one of the major things during the treatment is they have to go through a lot of chemotherapy, in which they will be the immunity is suppressed a lot, so you can't have a lot of visitors also. So you need to have a limited set of people who should be taking care of everybody in the house, and then you should not get sick, and you have to take care of a sick kid along with a newborn child in the house. So we simply divided the roles, and we worked on them. So taking care of kid is one person's, and so we actually divided all the things between us, and then we did the daily routine, and we actually modified our daily routine so that we can put my kids' treatment with our daily chores. So everybody will have time to do everything in a day. Second thing is like health and active maintenance of the body. So we have to be active. We never missed a meal in those 15 months. So the first thing we thought is like, we have to be active so we can take care of the kid. And we did work out, and we did go for walks and all whenever we get a chance, so that a healthy mind and healthy person can always take care of an unhealthy person. So that's the second thing which we have followed. And one other thing which I learned during the treatment is always take one thing at a time, 1 minute at a time, 1 hour at a time, and 1 day at a time. So in this long journey of 15 hours, you will have a lot of ups and downs. You will have a lot of good times, a lot of times which we won't expect, but always take it 1 day or 1 minute or 1 hour at a time. So let this hour pass, let this day pass, let this month pass, because as it passes, things will get better. And another thing is homework. So we did all the homework, because you will be talking to a lot of doctors and a lot of people, lot of new people, and a lot of new perspectives. Even though you may not know everything, you have to know, because all these medicines, all these new advices, all these new things, you don't know which one to pick, which one to follow, or whom to trust. So you have to do your own homework by either asking a person who you know, or by searching online, or by reading books, or by reading journals or papers or something. But one thing we did keep in mind while doing all this is like, there are n number of stories in online which may be good, may be bad. So make sure you are always strong, and don't get depressed by reading anything which upsets you in that day, because that day is really important, because there will be something else happening in your kids treatment, or something else is happening in the house. And other thing we used to do is like we used to make sure whenever my kid is active, or whenever his immunity is up, because during the treatment and every cycle his immunity will get suppressed, and then his immunity will be back for a couple of days, and then again he go to the next cycle. So whenever he is active, we will make sure that he will have his own time to play, or his own time to cheer up, or his own time to do things that he wants to do, going for a walk, or eating what he wants, or playing with the kid he loves, or something like that, so that we will keep his morality high and then active, so that we will be active the next day. And the last thing is like never lose hope. So there are a lot of things which will be in your way when you're doing or dealing with all these things. So always remember that there is, like we just heard Krishna, right? There is hope. So you have to be strong, resilient, and then there is a light at the end of the tunnel. All you need to do is like pass through the tunnel. So do whatever it takes to pass through the tunnel, but never lose your hope. So these are the prime things that actually we followed. So doing the same thing again and again and again and again, and at one day it stops, because he will be back and his treatment will be done. So my kid's treatment started in last May, and then it ended in this July. Now he's in remission, he's active, he's playing. So we did what all it takes, along with taking care of a newborn in the house. So my story is short, but that is all I have.
Thank you. Thank you, Neel. And I think Shanti is also here, Shanti, and I see her message popping up that talk about the home feed. So I know that you did a lot with and how Shanti had actually prepared each meal, for Karti, and making it all like it is with the ingredients and all fresh. And even though, you just had a newborn baby, and you did it all so that there is no compromise in any way from any aspect, right, Neil? If I remember correctly, all our discussions we had. So, and then also you brought up a very important point about the treatment plan. So it's so important for the parents to really understand, because I know, being a researcher, and nothing against anyone, but I sometimes see a lot of clinical trial in the market, which is more on the accumulating more data, because even the researchers, they need more data, and for that you're going to face so many proposals, like you can do this trial, but please, as Neil said, do your homework. That's so important. Talk to someone who really knows, and who can talk about the pros and cons, who can really so that you understand that what is the repercussion of it. Is there enough really statistical data to convince? And I think those things are very important that you brought up. And from the parents' perspective, and it's a huge learning for all of us over here, today. And I hope everyone can take it forward. And if you know any parent, going through the same, maybe you can connect them to us, and then I can connect them to Neil, and even to Krishna's family, because that is the big support that each family going through needs. And I think I know another family going through the same, and they haven't contacted me yet, but immediately once they do, I'm going to connect them to you both, both the families, and also, like, I know these pieces, when they come together, it kind of completes the treatment process. So that is really important. And thank you so much, Neil, for really, you, Neil, and Krishna, and Neil's family, Krishna's family are the bravehearts, are the heroes. And Dr. Hazarika, what you're doing for the community, I know what are the challenges you face, because I come from Assam, and everything is a challenge, so, and how you are overcoming, and with the infrastructure. And I know Borooah is really doing great. They've tied up with Tata, and You all are doing this amazing job, and hats off to you as physician and what you are doing for the community. And saying that, I would like to open the forum for any questions. I know there were many questions initially by Uma ma'am, but I think the reason why I wanted the questions at the end was so that I know many of your questions will be already answered, through the process. So now, if you have any questions, please, you can unmute yourself. And I want to really, really thank all the audience, all the participants, the guests who are our esteemed guests, all of you who have really taken your time on a Sunday morning in US and evening in India to come and support childhood cancer. And a big thank you to all of you. So the forum is open for questions now. Please unmute yourself and you can questions for the speakers. Yes. Yes, Shunu?
Is there any way to help the, people with childhood cancer? Like, is there any way we could support or help them?
Yeah, absolutely. There are many ways you can help them. I can give you all the avenues later, Shunu. So we also have we tied up, we are collaborating with the hospitals. We collaborate with Dr. Borooah Cancer Hospital also. And then I can definitely connect you in every possible ways. And I can, we can talk later, and there are 100 ways to help, whatever way you want. And Dr. Borooah Cancer Hospital in BCH, I know whatever way we can help from BCH perspective, we are always there, Dr. Hazarika, for your hospital. And
okay. Thank you, everybody. You were all really informational. So thank you.
Yeah, in fact, that's exactly the question I also asked Lopa to all of you, that you have a support system like how we have here our PINCO for adults, for us, for the kiddos, for the pediatric, do you have a separate support system, or the parents come and then they get the guidance? The children are not involved in it to share their stories?
Everyone is welcome to share their story. So we have the Breast Cancer Hub, Childhood Cancer Hub, and I have already mentioned to Krishna, she can share her journey, and then we will post it so that others get to know. And right now, our Breast Cancer Hub support group in the WhatsApp support group is very private, and we have all type of cancer in there. But one-on-one, I'm attending to everyone who is coming, reaching out, and I'm trying to do whatever I can for the families. But individually, there are many support groups on WhatsApp, on Facebook, and Neil can help me on this because Neil is a part of, Facebook group, which are totally for childhood cancer, right? Neil, you can help me on this and maybe throw some light for our audience.
Yeah, there are very good closed groups in Facebook. So most of the any question, 80 to 90% of all my questions, I found answers there. I found multiple answers there because in terms of diet, in terms of treatment, or in terms of how the kid responds, whenever I search everything, I see a few different kind of answers, because every kid reacts different to a food, or every kid reacts different to a medicine. So what to expect is that's where we learned on what can we expect the next day when he's going for the treatment or the next cycle of the treatment.
Yes, I know.
And
so on BCH group, I don't find many, being active about the kids. Yeah.
No, we are not. So, because our BCH group is mostly Krishna is there, but Neil as a parent, he has joined in, but I haven't created a separate one because there are already many closed groups on Facebook, which are very specific. Even they're specific for the type of childhood cancer. You will find neuroblastoma, one group, and when something is already there, I don't want to replicate something which is already available. So this group is more like a family, we function as one family, right? So, but we can definitely direct them towards the resources, and that is another goal that I have, because something is already there, we can channelize people and help them to be navigated towards those resources. And Neil, I think we have a question here from Archana, if we could share the link.
Yeah, I'm posting that.
Yeah, absolutely.
And even I was about to say the same thing, that we need the FB link.
Yeah, absolutely.
Another thing that I do. Yeah, sorry. Other thing I do when I do the bedside visit to the pediatric wards is I always find out from the child what is their interest. Some of them are interested to play Lego. Some of them want to paint. Some of them want to sing. Some of them want to dress up, you know. So some of them want to make jewelry, bead jewelry. They have their own interests and their own hobbies. So I always like to carry something for the child when I go to visit them. And you should just see the expression of joy. They're so happy. Quilling, especially a couple of pediatric children whom I had supported, they were so surprised. How did I come to know that they're interested in quilling? How did I get the present for them? You know, this is something small which you could do when you go to visit a child, just to bring about that smile. That smile, we feel that it is very important.
Absolutely. Thank you for doing this. You know, that's amazing of you, ma'am. Yes. And I think Bindu, you have a question. Please go ahead.
Yeah, I'm so sorry. I joined a bit late. So just wanted to know what is the most common type of cancer seen in the children?
Dr. Hazarika.
The blood cancer or the leukemias are the most common type of cancer seen in children. It constitutes around 1/3 of the cancer. And if you just add the lymphomas, which constitute leukemia and lymphoma, both constitute the hematolymphoid malignancies, that is the cancers arising from the blood or bone marrow. So they constitute around 50% of all the cancers. And this is followed by brain tumor. Second is the brain tumor.
Okay. And is this heavy? I mean, it is because of genetics or genetic problem, or is there anything that happens after coming to the world?
Yes.
You know, in case of children, the environmental factors, they do not play much role in their etiology or causation. Mostly these are genetic factors, but sometimes, you know, if the mother takes some drugs like diethylstilbestrol during pregnancy, or they're exposed to radiation in the form of X-ray or other forms of, radiation, or they smoke during pregnancy, and then these may affect the child, and then child may, it may cause cancer in the child after birth. But in most of the cases, it's like genetic factors. Because see, if you have one environmental factors, like for example, like smoking, or environmental pollutants, then it takes around 15 to 20 years to develop cancers, because these environmental factors will make change in your genes. There will be mutation or other some genetic changes, and from this change to develop cancers, it will take around 15 to 20 years. So by the time the person, even if the child is exposed to environmental factor just after birth, he will become adult till there is development of cancer. So mostly childhood cancers are your genetic.
Thank you so much.
So does the genomics help, like before they get married or during their engagement or something, if all the couples they do genomics, supposing there is already a history in the families, just to rule out the possibility so that they don't conceive, so that they take care. Is that a necessary step, do you think, doctor, to do?
There is no evidence that
Genetic.
any chromosomal analysis or any genetic study before marriage can predict development of cancer in the newborn or in the next gen. There is no evidence, but of course there are some immunological disorders which can be diagnosed before birth, which has higher incidence of development of cancer than the normal siblings. But as of now, there is no evidence that any genetic study can predict the development of cancer in the newborn or the next gen.
Thank you so much, Dr. Hazarika. And I can also chime in a little bit, Uma ma'am, over here, because usually what happens is with the cancer scenario, right? There are many tumor suppressor genes, DNA repair genes. So those mutation, only very less percentage that we may carry the mutation, like BRCA mutation for breast cancer and other tumor suppressor gene mutation. But as Dr. Hazarika said, to really analyze before marriage to figure out, okay, only few genetic mutations, but that also is very random. I mean, we cannot just say that, okay, I'm having this mutation, so definitely I'm going to have cancer. That's why I'm not going to get married, or I'm not going to have babies. So there's the pedigree analysis is so different and difficult. So I don't think we should make a judgment and, really put it on the science and genetics and do the testing. Yeah, there are different, the CLAP factor. Dr. Hazarika, you can clarify that those are the Down syndrome. Those things we can definitely do the chromosomal with the when we are carrying the pregnancy. But other than that, making a statement to get married or not to get married or conceive or not, it's still only 5% is actually known to the world. I would say 95%. There are so many genes in this world, like only few of the genes we can actually study and say, okay, this is causing this particular, this is a promoter gene, this is causing this particular drive of the mutation, KRAS. There's so many mutations that can happen randomly also through the process as we are growing up. So that is what I would like to say, so because the society has become so clumsy with all of this that we really, I think nothing goes above love and affection we need to have for each other. So when we love each other, I feel we should get married. That's the only criteria I feel we should be.
Yeah.
I know, I'm very, I mean, you all
lucky, because you're lucky in love and you've got two lovely kids. So it's good. God has been good.
I know. I mean, Dr. Hazarika, Neel, and Krishna can chime in, and anyone can chime in. But it's a very difficult scenario, and no one should blame anyone. That's what I feel. Even if it's genetic, parents shouldn't be blaming themselves that because of me, because there are things which are destined also can happen. I mean, doctors told me I can never have babies. I had 7 miscarriages, but I had conceived naturally. So there is above, there's something above which kind of like positivity or a superpower. I don't know. So I don't have an answer to that. But
that's the famous Indian philosophy, right? Thank God for our philosophy.
Yeah.
Say, we are not responsible. Someone else is there who's pulling the strings. We're just, the puppeteer is there and we're just the puppets.
Yeah.
So, I mean, once you realize that, then you don't blame yourself also, Say, okay, that's my karma.
When I was having miscarriages, I was being blamed that, okay, you might have done something wrong in your life. That's why you're having all these miscarriages. So, it's not that I didn't hear anything. I heard, but, I was like, I know who I am, and I know, never let anything come to my focus. I know what I need to do. So everyone, we all go through so much in our life. People will say so many things, but we just need to be, believe in ourselves. I think that's
turn a deaf ear to a lot of things.
Yeah, I mean, just try to do the right thing, and not hurt anyone. That's the important.
Yes, that's the main thing.
Yeah. So I think
we need a little more awareness camp, because we have done a lot for breast cancer.
Yes, for childhood cancer, we definitely need a lot of awareness.
I think that we should do some awareness camps.
Yeah, absolutely. I mean, that's why we are doing it. This is September month, and that's why, though it's Breast Cancer Hub,
but not many people get onto this now.
I mean, the problem is that, Uma ma'am, even if I'm putting it out on Facebook, even each of you will share, it will be only like 1% of even from our friends network who will join in. Because, until and unless people face it, or they're really concerned or what is going on, their fascination or inclination towards crave to learn, people will not. So it's like, I post so many things, but I just get 1 like or no like at all about cancer. I mean, that doesn't, but still we will keep going. because we will not stop ourselves, or we will not demotivate ourselves. We will keep going. So definitely everyone over here we would love you to spread the word about childhood cancer awareness, so that we can spread. You can talk to, you're associated with so many organizations, Uma ma'am, you can talk to them. They can hold seminars and all of that. They can post on their walls, and we will also do something with early detection of childhood cancer. And because I'm planning to make cards for childhood cancer awareness, so that we can post it, and I will share it in our group too. So I think there are many ways we can really come together.
Spread the awareness, to spread the awareness. I mean,
spread awareness, and when someone is detected, how to, as Neil said, like,
how to handle it. Yeah, how to handle it, how to face it.
Handle it and face it. How Krishna's family and Neil's family did. They're great examples for all of us. I think any more questions from the forum?
Lopa, this is Arijit, just one question. First of all, thank you so much. This was such a factual plus inspiring talk. I mean, I couldn't thank all of you enough for doing this. And I am so privileged to be part of this today. So from the bottom of my heart, I want to thank all of you for going through a journey, sharing your journey, and then letting us know, spreading a little bit of that awareness in my mind. I thought I knew a lot of things, but then I realized there's so much more that I have to learn myself, right? So thank you so much for doing this. My only question to the team is, or Lopa, my daughter couldn't join today. She had to go somewhere, but is this recorded that I can share, and can I share it with my friends as well? Is there a way for us to do that?
Yes. I took permission from the speakers. So the session is recorded, and I'm going to share it with you, Arijit, and also with all the forums. So please share it. That's another way, Uma ma'am. So you can share it with your.
I was about to say that since you have recorded, I will forward it to.
Absolutely. I'm going to make it to a YouTube link, and I will share it with everyone over here. And what I will do is, we had 58 or 60, I think 58 participants sign up. So I can also email them the link. So whoever signed up means they had the interest. So now they can also, even though they are not here today, but at least they will get to learn from all our speakers about the childhood cancer awareness. So
hello? Can I have a question for Dr. Hazarika?
Yes, please. Go ahead.
Yeah, I am from Mumbai. I want to ask a question to Dr. Hazarika. I see a lot of patients, particularly from Northeast, at Tata Memorial Hospital. And I have observed that cancer registry tells evidence of or incidences of any type of cancer are more in Northeast. One thing, is it true? And secondly, the same thing, does it happen also in the early childhood cancers?
Actually, I was just typing the answer to you only.
Okay. Sorry. Thank you.
Okay.
Yeah, thank you.
So, no, it's Northeast. It's not the in case of childhood cancer. It's not Northeast doesn't have the highest number. I think Delhi registry, the highest number is registered in Delhi registry, I think. But some other adult cancers, it is the highest in Northeast. One is your oral cavity cancer, then your gallbladder cancer. Gallbladder cancer is highest in the Kamrup urban registry in the Northeast India, and Delhi, I think, is the second in gallbladder cancer. And this gallbladder cancer, it is the second highest in the world after child. And then esophageal cancer is also, I think, highest in Northeast. But childhood cancer, it is 7th or 8th position, I have forgotten, in the latest this publication, which was published just last month. So fortunately it's not, but maybe because it is maybe because of the underreporting also. But you should understand one thing, that since environmental factors doesn't play much role in the causation of childhood cancer, so actually the incidence of childhood cancer is almost similar in all over the world. And so it's true for all all the states of India also. So the incidence, it is almost similar, but maybe because of the less reporting, we see the disparity in various cancer registries in India. And Delhi, maybe because the people are more aware, so there are more registration. Otherwise, I think the incidence is almost same in all over the country.
Okay. Thank you, ma'am.
Thank you. And thank you so much, Dr. Hazarika, because I didn't know about the childhood cancer, but regarding the adult cancer, I see a lot because I have been working so much with the village adoption and doing all the screening camps in Northeast India and also all part of India. And I see, as you said, like it's very high in Northeast India, the oral cancer, and one of the main reasons is the tobacco. Because the tobacco chewing and it's not only restricted in the oral cavity, but it also goes in the system. And also now when I'm talking to more and more oncologists and doing more intensive work in India, I'm seeing a lot of breast cancer is also rising very highly. And as you said, is underreported. And that's why from BCH, we're trying to tap into the untapped areas, get the epidemiological data and trying to publish those so that people get to know the reality. Because what we see is the registry is just a few representation, like in Assam, we have the Dibrugarh, and as you said, few, but where are the other registry data from Assam by itself? From maybe Hyderabad, only 1 or 2 registry data are there. So that is the biggest issue we have. And then also a lot of times I see cancer patients, like I go to these villages and people are saying like 5 women died of breast cancer last year and nothing is reported, so where, they are reported, they go, they are dead, that's it. It's just a closure. So there's so much we can do as, collaborate with each other and work towards like the scientific standpoint too, because that really builds the foundation, the cancers, to understand the true cancer scenario in the developing countries. Thank you for bringing this, and I don't see your name, so but thank you for bringing this up.
I had a question. So, does like your diet or like obesity or like any of those deficiency affect your rates of cancer?
With the childhood, so Dr. Hazarika?
Yes, of course. And now many cancers are like related to your obesity. And of course, some of the cancers are related to deficiency of various vitamins and minerals in your diet. So definitely diet plays a very important role, not in childhood cancer, of course, but in adult cancers.
Absolutely. And Nirali, the obesity, like for the last year science project, we had one full project, a group of students, I made them work on obesity and cancer. So, and also there are many projects we worked on diet and cancer. So diet and lifestyle, obesity, there are many underlying inflammatory factors that really contribute to the development and also with the progression of cancer. So definitely that's why healthy lifestyle is very important. Smoking, drinking, then, avoiding junk food is very vital for all of us.
Sorry. So I also have a question. So let's say before pregnancy, like, let's say the actions like let's say when you're a teenager and you did something like bad, you like started smoking at like a young peer pressure and stuff like that. So that because it's like happening like a lot now. So let's say like you got married and you're pregnant. So would that affect your baby or any child that you have? What your actions you did in the really past, will it affect anything in your future?
With the child, so Dr. Hazarika has already mentioned with the childhood cancer, I think Dr. Hazarika, you can throw some light on Shrunu's question. What he's asking is like when we are teenagers and if the kids are smoking and drinking and then once they get married and once they are going to have a baby, is that going to, that lifestyle like 10 years back, is that going to affect with the upcoming baby to be born?
See, Definitely, that doesn't directly affect the baby. So, but definitely affect the parents, parents of the baby. So see, if you they go on smoking, so actually the development of lung cancer or development of oral cancer after like smoking or taking tobacco, it takes a very long time, as I have already told you. So it also depends on how many cigarettes someone takes, for how long. But one very beautiful thing is that if you stop smoking or stop taking tobacco, then the risk goes on decreasing. The risk of having cancer goes on decreasing, and finally it risk of having cancer will be same as a non-smoker. So anytime in your lifetime, if someone has started smoking, they can always quit it. And then about the children, or about the newborn, the thing is that if the mother smokes during the pregnancy, or she takes some drugs during the pregnancy, or she is exposed to radiation during pregnancy, and then definitely the child may have cancer. The child may have cancer when it is born. Otherwise, there is no evidence that if the parents are taking, they are exposed to these environmental factors, they should affect the child also, unborn child also.
Yeah, but definitely affects the person, Shunu, because as in the mentoring session also I mentioned, like no way we need to introduce smoking irrespective what age we are in, because it's going to damage the DNA of your cells, and it's going to affect, as I said, that there are repair there. So our body basically, I just don't want to go into details, but constantly the body's DNA is getting damaged, right? But there is a repair mechanism which is helping. There are tumor suppressor genes helping in repair mechanism. But if you are disrupting the system, maybe you may not see the effect now, but in the long term, this may come to an effect, because slowly and slowly you are actually triggering the process. And also these things trigger low-grade inflammation in the body, which equally, controls and helps with the, the repair damage of the DNA. So it's always important that we stay away and stay healthy, whatever we can, to the best possible capacity, which is in our hands. There are environmental factors, there are water pollution, environmental, which are not in our hands. We can't help it, but we have to exercise, keep our body circulation in the movement, because it always helps with the immune system. So these are the ways, these are the preventable measures, and it's always better. But with childhood cancer, it's very difficult too, because the kids are so small. It takes time, as Dr. Hazarika said, to build it, like to exposure to the environmental factors, and then, when you have it, it takes time. But we definitely need to follow a pattern of a healthy lifestyle to help ourselves.
Okay, thank you, Dr. Hazarika.
All right, so I think it's 10:33 now, Eastern time, and I think we have no more questions. So, but we can wrap up the session. So a big thank you to our speakers, Dr. Hazarika, Krishna, and Neel. We are really grateful.
Look, sorry, I had also brought up one point of financial help, because it's really like,
so I can,
there's no insurance and
so what happens is that, Dr. Hazarika, you can chime in. So with the financial help, like I can tell you exactly what we do in the villages we have adopted from Breast Cancer Hub. So we actually make sure if they have the BPL card or not, Ayushman Bharat and the Bharat Abhiyan card, and then if they do not, we check with their financial, with their we do a thorough screening of their check, like what is their financial status. And there are hospitals like in Kachar in Assam, Kachar Cancer Hospital. So they come below poverty line, they come under this. And I know Dr. Borooah Cancer Hospital does the same. But then there are many NGOs who are coming forward to help. But the problem is with the low and middle income group who do not have insurance. And that is the biggest hiccup I feel that we face the same, like people reaching out, and they are neither, like the treatments are so expensive. So, I mean, Dr. Hazarika, you can fill us up over here a little bit, you know, how Borooah does it, but especially for the middle income group people who do not have insurance.
Actually, I put a few slides, so which last moment Lopa knows. Last moment I removed this child. How these NGOs or the non-government organizations or individual help can change the scenario. Actually, I'm giving the example of my institute. In when I joined my institute in 2006, then there was like only 30-40 new cases were registered in the year. There was no pediatric oncology unit, and the patients were kept along with the parents, and then in the adult ward. So, and there was no help for them. If like they could afford, they continue treatment, otherwise they left. So then we tried, and then at that time, like many organizations, they came forward to help us. Then during the last few years, you know, our like new registration increased, and now we see around 500 new cases in, you know, in the year, 500 new registration in the whole year. So, and our like you know, that you know, death rate also decreased. Our cure rate increased from 30-40% to now around 70%. And the most important thing is that the treatment default, you know, it decreased. The treatment default decreased. Earlier, around 30-40%, you know, children, they defaulted because they couldn't afford the treatment. But now, like almost all children, only a few just defaulted. This was possible because of the help from many non-government organizations as well as many individual donors. So we just mobilize money from CSR fund of various companies, and so each and every child now gets like free treatment. Their investigations are free, treatment free. Now, another important thing, that one pediatric database you know, was developed by a Dallas-based organization. So they like supported us with like social worker and data manager. Now we know where we stand. So they just call the patients for follow-up, for treatment. If they are late for 2-3 days, immediately our social worker, they call them, and we provide like help for transportation also if they cannot afford it. Then some organization came forward with like dietitian and nutritional support, so they get food. And not only the patients, but if they have siblings and they need nutritional support, these children are also like supported. And then some home away from home were established nearby the you know, treatment center. So these families can stay there free of cost. So free of cost for 2-3 years till their treatment is completed. So everything is free there. So as a result, you know, the treatment defaulting, it decreased like anything, and our cure rate improved. And so all these were not government, you know, scheme. All these were like done by this non-government organization. So this is how, you know, every individual or the non-government organization can help to improve the cure rate to like 80%, if not 80%, at least 70%. And of course, since you know that there is no role of the environmental factors, the disease are same in low income countries as well as in the high income countries. Disease is same, you know. So if we can provide proper treatment, if you can mobilize the resource, then I think the cure rate will be same in all the countries.
Yeah.
Yeah, but don't you think all of us should also get together and see that the insurance companies, you know, they don't. Personally, even I myself, I think Lopa knows about it. After I got my 30K or whatever, about 20 years ago, after my mastectomy, the next year when I applied for renewal, they refused. They said pre-existing. So now what do we do? And I see many of us have lost the medical insurance also now. So don't you think coercive action, like to insist upon the government to, you know, formulate all these rules so that everybody gets, you know, they only want the 18, 19-year-olds to take the insurance policy because they know till about 40, 45, generally, hopefully all the kids are good. It only starts like after Charlie's, right, with eyesight. So now, isn't it possible for all of us to get together and do something? Because I work with NGOs, I work with a lot of CSR, CSA groups. They're also all drying up, especially now, this year, Lupa, because of the COVID situation. All of us have given, you know. So now the funds are also like drying up. So don't you think it's a policy decision by our government to have extend a hand, you know? I mean, I think all of us should get together.
Yes.
And demand.
Yeah. No, we are trying. So Arijit is in our group, and we just had the team meeting yesterday. Neil is also involved. So what we are trying to do is at least create a database where we can have the hospital registry for the underprivileged and low income and middle income group. So my thought process was to create this database so whoever can reach out to us, we know exactly where to navigate them, but not for the high income group, for the low income group. And also like we are trying to find the pharmacies who provide the low subsidized chemo drugs, you know, so that people, whatever is 25,000 rupees, if they can get it at 5,000 rupees, that's also a big help, right? So that is something we are doing. We are also trying to, to coming to your point, another project that we are planning, we are going to start. Archana is also here, she is also in the team. So what we are trying to do is voice the opinion of the patients and the survivors and their families and take it up finally, like, you know, about the drugs and to request appeal for the pricing strategy and everything. And eventually that's a good point, we can, but the insurance company, their strategy is very different. And we, even US also, we face the same thing. So, but US is much like, you know, with the mammograms we face, like we do not do ultrasound, we do mammogram because insurance doesn't cover. I don't want to go into that route, but we are trying from Breast Cancer Hub. I'm thinking of different ways to give a long-term solution. This will take time, but definitely planning for a campaign soon. So please stay tuned and we will reach out to you about all the other background processes on the financial standpoint. Yeah.
Thank you. Thank you very much. Lovely evening, Lupa and Hazarika, and of course Krishna. So awesome to hear her talk about. I knew immediately it was her own journey because Krishna, I thought, okay, it's her journey. So sweet. Thank you, Krishna.
Yeah, so thank you. So I'm assuming we don't have any more questions, but if you have, you can please email me and I can connect you to our survivors, and we have a support group too. So everyone is welcome to join. And thank you so much, Dr. Hazarika, for the insightful, you know, from oncologist, pediatric oncologist perspective. It was really and great discussions too. And I think we have come to the end of the session, so we can close the session with a big thank you to everyone here and for your time on a Sunday morning. and evening, Sunday evening and morning, both ways. And I'm glad to see many students doing a great job.
So this is the way we do. Shine on, shine on. Everybody shine on.
Okay, so I don't know. Okay, shine on. Bye. All right. Bye, everyone. Thank you.
Bye,
Thank you,
everyone.
Lopa,
Bye.
and everyone.
Bye, Baba. Bye. So now you know
It
you
was
can
a good
smoke.
time. Thank you. Bye-bye.
Bye, doctor.